The vaccine represents a real light at the end of the tunnel in the way that nothing else does.
Lots of masks, lots of gloves, more alcohol, hand gel than I think I've ever seen.
I'm very excited to be having the vaccine, as I think everybody else is.
Everyone's just happy about it.
The thought that it was finally coming in was the best Christmas present that we could have had.
I'm Graham Cook, I'm a Professor of Infectious Diseases and I work in Imperial College Trust. So the first Covid-19 vaccine that we've got approved and is being rolled out in the Trust is the one from Pfizer-BioNTech. So the benefit to staff being vaccinated is a benefit to themselves. The benefit to the country as well will be in order to maintain a strong healthcare system.
So from a site perspective, the things we need to consider to look at the vaccine rollout, it's the bigger stuff, like actually the location itself and make sure that we can get access and that there's enough space to accommodate everybody, right down to those smaller things like have we got enough waste bins, how do we make sure that we clean all the touch points during the actual vaccination process itself.
Rolling the vaccine out to staff at the Trust has been a huge task. So logistically, to roll out vaccination on the scale that we are doing at Imperial is quite a task. We've had to find sufficient space to vaccinate our staff. Logistically, the challenges are around setting up booths so people can have privacy when they're vaccinated, and also making sure that we've got sufficient space between those booths so we can continue to maintain appropriate infection prevention and control procedures to keep people safe whilst they're being vaccinated. And then comes with it everything else that you'd expect, lots of masks, lots of gloves, more alcohol, hand gel than I think I've ever seen. And we're really lucky that lots of it comes when the vaccine's delivered.
We're actually in our medical records department, but it doesn't look much like it usually does because we've cleared it out and we're starting to set it up as the vaccination centre. When the news of the vaccine being approved came out, I was really quite elated. The vaccine represents a real light at the end of the tunnel in the way that nothing else does. Vaccine we give here represents another glimmer of hope and another way and progress towards the end of this pandemic. Thursday will be a really great day because it will be the first day that we're going live with the vaccination centre here.
Is it the vaccine?
Yes, it is,
Oh,
yeah.
brilliant, thank you.
Okay, thank you very much. See you.
Bye.
When we were told that we were going to get the vaccine, I was so excited. I was really delighted. The thought that it was finally coming in was the best Christmas present that we could have had. However, then I just had immediately, oh my goodness, what are we going to do? How are we going to do it? And I was so delighted and daunted at the same time. That's how I felt. So we place an order for the vaccine so we know when it's going to come in. We make sure that we meet the delivery and we bring it down into a designated area where we unpack it. And the main thing about unpacking it is making sure that that we check it on arrival, we check the outer box, we transfer it to our cold storage as soon as we can. It's also about managing the dry ice, so we have to make sure that we wear aprons, gauntlets, face covering, and that we dispose of the dry ice according to our procedure and in a safe environment. So we're using the Pfizer-BioNTech vaccine at the minute, which has a 5-day shelf life once it has come out of its ultra-low temperature storage conditions. And with this vaccine, there is even a limit on how many travelling hours it can have and how many journeys it can have. So of the 5 days that we probably get 3.5 days in which to be able to use it before it expires. And that's unlike any other product that we get into pharmacy.
So when staff arrive, first of all they'll be met at our registration desk where they will be asked to check in. Here at Hammersmith we've got a total of 6 vaccination pods. So once staff are registered, they'll come through and they'll take a seat here waiting to then be called through into one of the vaccination pods to receive their vaccine. Once they've received their vaccine, there's a need to wait for 15 minutes and be monitored for 15 minutes after the vaccination, which staff are then doing over here. Over here we've got one of our fantastic pharmacy team who is reconstituting the vaccine. So when the vaccine arrives, it has to be mixed with a diluent and then be prepared and moved into a state ready to be vaccinated, ready to be administered to someone.
Well, I'm very excited to be having the vaccine, as I think everybody else is, but particularly for us, for me as a medical student, a lot of our learning is being in direct contact with patients and interacting with patients to understand their conditions and their experiences. It was very quick and easy. I just turned up for my appointment slot, they just took my NHS number and then I was just given a card and just went and got my vaccine, that was it.
Right, I'm Freddy de los Reyes and I'm one of the renal nurses here in Hammersmith Hospital. Well, everyone is actually so excited when they heard that the vaccine is going to roll out. And yeah, everyone's happy about it.